When we treat the shoulder, I prefer to do this from a side-lying position because most people are most comfortable in this position, as well as it gives us plenty of room to stretch out the pecs when we need to and treat just about everything in the shoulder joint from anterior to posterior that we need. We're going to start off just by warming up the trapezius. Just whatever warming techniques you want to use. Just using some moderate pressure as I just turn my fist right over the muscle, hooking that fascia and slowly releasing. Or if that is uncomfortable for them, we just do some full-handed petrissage, picking the muscle up, pulling it away from the bone slowly, helps increase the heat and reduce any adhesions or tension in the muscle. When we get into the supraspinatus, and we know that the supraspinatus is one of the most commonly injured of the rotator cuff muscles. So if we can reproduce the area of the strain, then we can treat that specific area of strain and get some pretty quick results in rotator cuff strain. So number one, we're going to do a manual muscle test. So I'm just going to hold his arm as he abducts, which is raising the arm away from the body, and elevate the shoulder. Hold him for 2 or 3 seconds. Let him engage the supraspinatus. Relax. If there's any discomfort, have them point to the specific area of discomfort. Any discomfort there?
No.
Okay. So we're just going to pretend that he had some right in the belly of the supraspinatus. So I approximate that muscle, come right into the supraspinatus fossa, right on the area where he pointed to, and then I'm going to do multi-directional friction. The multi-directional friction, remember, helps realign the strained tissue with those little micro tears back into alignment, and then we can retrain the muscle through just gentle resistance. So just with about 2 fingers of resistance, I want you to raise your arm up towards the ceiling for me, and then just shrug your shoulder a little bit as you raise up as far as you can comfortably, and relax. Give them a gentle stretch. Now for the supraspinatus, the stretch would be behind the back, as far as they can go comfortably, stretches out from insertion to origin to insertion, and retest. So test from the same position that you did before. This time you give them more of a resistance as they raise up, and relax. And once you get good at this, it usually only takes 1 or 2 tries to get those fibers back in alignment. But remember that the shoulder girdle is one of the most complex parts of the body. So it may be a combination, their shoulder pain could be a combination of rotator cuff strain, as well as bicipital strain and just general tightness, as well as you have to look at other possibilities such as bone spurs, bursitis, and other areas of the rotator cuff that may be strained. Now we're going to go on to treatment of an infraspinatus strain, which is also very common, especially in golfers. Very common injury to have. If you can catch it early within a few days or a few weeks of injury, you can fix it right away and they can get back to their golf game.